Thanks for inviting me to come here today. And I feel an outsider in two ways. First, I'm not a member of the Academy, and it's an honor to be here today and surrounded by so many specialists and experts in so many different matters. But the other thing is that I come from the field of psychology, more specifically the science of relationships, and I don't speak the language of the economists, the philosophers, the anthropologists, the political scientists, and the lawyers in the group. So I've been struggling for the last 24 hours about how I could change what I was going to present to make it relevant for you. So forgive me for the style of presentation, for the way I wrote the paper, but it's typically not the way in which we work in the field of psychology and the science of relationships. So I hope you can take something with you today. So basically, my thesis is that in times of crisis and when families have to cope with the stress, there is a possibility of stress having detrimental effects on family relationships, but there's also the possibility of seeing crisis and the stress that comes with it as an opportunity for strengthening family bonds. And what I'm going to address today, to what extent that can depend on what the families do. I'm not going to go to the level of what governments can do, but more what we can offer families so that they can make the best out of those situations and come out strengthened out of them. So a couple of caveats about my presentation. I'm a psychotherapist, so a lot of what I'm going to say comes from my experience of working with immigrant families in the United States, my work from Argentina, where I'm from, and also from working with African immigrants, the French-speaking African immigrants. And then from my research has been mostly on how couples cope with immigration stress, economic stress, and medical conditions. And then from, I don't know if I'll have the time to get into that today, but you have it in my paper about a community program. I developed some community programs, but I had the luxury of getting millions of dollars of funding from the government in the United States that allow me to provide services to low-income couples that are struggling with economic stress and relationship distress. And another caveat is I'm going to be addressing stress in terms of external stressors, which is there are different ways of looking at stress, but I'm not going to be dealing with the stressors that happen within the family, such as, death of a family member, but mostly what stressors that affect many families around the world that come from the outside in a way. And I also want to say that my presentation would be limited in terms of the wide cultural and socioeconomic status diversity that is present in the stress and coping experiences. So many of you may have reactions as you're hearing talk and so, well, this doesn't apply to this context or that context, or you're living out this or that. It's very difficult to cover the vast diversity of those experiences. So this is a little bit of a scope sections that I'm going to go through, but basically comes down to looking at what is the stress, what is the impact of a stress, the stresses we had before the pandemic and during the pandemic. And I really want to focus on the limitations of looking at stress from a perspective of what the individual can do only, but looking more at what we can do relationally, and then some recommendations, and if I have the time to go into this program that I told you about. So first, in terms of what is a stress and stressor, a couple of things. In the field of psychology in the 1980s, we have Lazarus and Folkman providing what has become sort of the way we talk about stress and stressors. And stress is defined as the perception that the demands of a situation exceed the personal and social resources that the individual is able to mobilize. And the stressor is actually the stimulus, whereas coping is the use of the cognitive and behavioral efforts to master, reduce, or tolerate the internal or external demands that are created by the stressful transaction. Before the pandemic, it's important to know that in the last decades, families had been subject to very high levels of chronic stress. And that comes from, as Professor Sachs showed yesterday, very high financial demands. Families are constantly struggling to make money in different parts of the world to meet all the needs they have. And the demands are increasing. There's an increasing demand at work, so there's a stress coming from workload. For balancing work-family responsibilities, we have increasing rates of families with 2 full-time working parents, and trying to manage time and trying to manage, all the demands of time that has to go to work and to family responsibilities. And in the United States, is the issue of healthcare, affordability, and access. So in a way, this paints a picture of families constantly struggling to have more time and to have more money. Additional stressors for some specific groups are, if you're talking about low-income families and safe neighborhoods, then there are stressors related to being an immigrant and a refugee, to being discriminated for different reasons. And then in many parts of the world, we have families struggling with the consequences of natural disasters coming from climate change, and of course, where families are affected by war and military interventions. So by the time the pandemic hit, we just have an exacerbation of those stressors that were already present in family life. And then we have the addition of many others. I'm not going to go through the whole list, but everybody knows the changes, the disruption in routines and lifestyle, the hypervigilance to prevent contagion, the issues of digital literacy and technological barriers, the loss of loved ones, and the high levels of trauma for those that had to deal with COVID, just because, either because they lost family members, because they had to deal with long COVID and their complications, and of course those that were first responders and essential workers traumatized by the experience. So we have a Stress in America survey conducted by the American Psychological Association since 2007, and that's the result of the high levels of stress that families experience. And when they conducted in 2020, 8 in 10 said the coronavirus pandemic was a significant source of stress, and 7 in 10 said their stress had increased over the pandemic. And this chart shows briefly how between 2019 and 2021, we still had the same stressors that existed before the pandemic, but they were actually exacerbated. You have at the top work, money, the economy, family responsibilities. And more lately, because of Russia-Ukraine conflict, we have also individuals highly concerned about global uncertainty, the potential retaliation from Russia, and Russian invasion of Ukraine. So we keep adding areas of concern. So there's a lot of research, and you have in my paper the actual studies that show the consequences of stress on physical health, on mental health, and on relationships. And so I think this is well known. This is part of pop psychology, I would say, folk psychology, that is related to hypertension, heart attacks, stroke, diabetes, obesity, gastrointestinal disorders, changes in appetite, changes in reproductive system, and also alterations in brain development in children. Now, we also have the indirect impact of stress in terms that stress modifies our sleep, it creates disruption. Many start smoking, drinking, using drugs, and exercising less. All of them have an impact on our health, on our physical health. In terms of the mental health, for both adults and children, we see increases in depression, anxiety, post-traumatic stress disorder. For adults, smoking, substance use, drinking, eating disorders, sleep disorders, emotion dysregulation. And for children, in emotion, also increases in self-dysregulation, emotion dysregulation, academic difficulties, and behavioral problems. So this is why there's so much research going on to how to work around stress, how to prevent these detrimental effects of stress. And I want to say that in all this that I'm putting here together, this is observed across different types of stressors and in different parts of the world. During the pandemic, of course, the concerns about stress on mental health have been very high. In the United States, there's a very high demand. We're at the peak of demand of mental health services and a scarcity of such services. We have here in 2020 that over 70% of the United States of people reported feeling restless, sitting around and doing nothing, finding it hard to think properly or concentrate. They felt lonely, miserable, or unhappy. And that's why we have such an increase in diagnosis of anxiety, depression, insomnia, again, PTSD, substance use, suicidal ideation, suicide and drug overdose deaths. And the situation is not very different from children. We have had an increase, in mental health related emergency visits. And you can see there that for children between 5 and 11, an increase of 24%, and for adolescents of 31%. And on top of that, over 70% of parents report that their children have had a mental health issue during the pandemic. So I'm going to spend now a little bit of time here on looking at the impact of stress on relationships, because I think that that's perhaps the thing that you will take with you. External stressors that start at individual level make their way into relationships through a process that we call in psychology spillover. Basically, when we are stressed, we experience psychological distress. We're preoccupied with the stressor. We may spend more time thinking about it. We may be less present in our interactions. We may become hopeless, and we become typically more irritable, less patient, less empathic, and that has a negative impact in our relationships. And here when I'm talking about families, not just with our partners and spouses, but also extended family members with children. That leads to conflict in relationships and eventually dissatisfaction with the relationships. But that psychological distress also leads to poor parenting and what we call parental stress, and that has, all the research shows, the impact it has on children's academic, social, and behavioral problems that are also related to parental conflict. In terms of stress also affecting time that families shared, I know the pandemic is a paradoxical example because we started spending more time together, but in general, stress reduces the time we spend together, in part because we take care of the stressor, but also in part because we are more into ourselves. We are less other-oriented, and we tend to spend more time by ourselves. All the research shows that, and that's linked to poor parenting as well, and conflict in relationships. There are also those arrows that show direct effects from reduced shared time and psychological distress into dissatisfaction with relationships and children's problems, because our perceptions also shift, are more negative when we're under stress. So the important thing is that there are risk and protective factors. As you can imagine, the risk factors are related to pileup of stressors, limited material resources, individual characteristics, biological predisposition, poor family relationships to begin with before the stressor appears, no relationship time, lack of a sense of meaning, social isolation, and maladaptive coping. The protective factors are exactly the opposite, and the ones that I want to focus on more today: what is adaptive individual coping, coping flexibility, healthy relationships, shared time, and relationship coping. So during the pandemic, we have an example of how the stressors were high, but not everyone reported negative outcomes. So I think that there is hope. There's a way in which we can help families. Half of the population in the United States were reporting feeling distant, withdrawn from their spouse, that there was conflict, domestic violence, and an increase in harsh parenting. But there were also positive outcomes. There are several that reported increased closeness, emotional reconnection, and support. When we look at that, a lot, why that happened, a lot depending on the quality of the relationships and how they coped with the pandemic. So here I'm going to spend some minutes describing what we see the most when we think about stress in psychology and in the social media. And if you really try to find out how to cope with the stress, what you're going to find more frequently is a focus on individual coping strategies, which is about how individuals can feel better. But such a focus on the individual is limited, as we're going to see. Usually these strategies go into trying to resolve the problem, the stressor, or trying to feel different about the problem, like, looking at it from a different perspective, trying to vent, and sometimes some of those strategies are maladaptive because we try not to feel by avoiding the problem, like such as drinking or sleeping long hours. The key thing here is the flexibility of trying to adopt strategies that are helpful for the type of stressor we have. And then there's a proliferation of psychophysiological stress reduction techniques that involve, for example, meditation, mindfulness, relaxation, and breathing techniques. Again, everything centered on the individual, including sometimes it's included in all the literature, we have religious coping. And even religion is introduced as a way of, either looking at the situation and giving it a positive meaning and trying to reduce the negative emotions that come with the situation. But again, in a very, I would say, pragmatic, utilitarian way, I would say, and you're going to see why I say that. I think that the danger of having such an individual coping approach and not talking about family relationships, when they are talked about, is from an individual perspective, is like, how can others help me? Whereas what I'm going to propose is a little bit different. Because when stress and coping in the context of family relationships means that whatever my experience of stress and my coping strategies don't happen in isolation. We're part of a system, and they have an impact on others, particularly our other family members. So the absence of having a focus on family relationships is the risk of deteriorating family relationships. We see all the time in family members that adopt individual strategies that are good for themselves, but are not good for their relationships, are not good for others. Just think for a minute about the things you do to cope with the stress, and think about them, how much of those strategies are good for others in your family group. And not all strategies are beneficial. It may be helpful for me to take 3 hours of yoga and 2 hours of relaxation activities, but that not may be good for my children, not may be good for my partners. And that's a very simple example. I'm sorry, but if you go online, that's the first thing you find all over the place. It's like how you take care of yourself. So a family-focused approach to stress means to really look at the family relationships and pay attention to them and think about coping in a way that nurture them. It also means to develop positive, healthy relationships across the board, not just before even you are dealing with stressful situations. Of course, because family is important for the many reasons we talked about yesterday, but also because during stressful times, all the research shows that family is a source of instrumental social support, is a source of meaning, and reduces the negative effects of stress on physical and emotional well-being. There is a lot of research across different stressors and across the world that actually point to that. So relational coping, that's how I call it, as different from individual coping, is an idea that I extended from the concept of dyadic coping. That has been my area of research. That concept was developed by Guy Boatman in 1997 in the systemic transactional model, and it's simply what I said earlier, is looking at stress and coping in relation to in relationships. So it can easily be extended to the context of families, so that we're not talking about just two individuals coping, but more than two in a family system. So what is relational coping? I'm going to go into the details, but basically it's like coping with others, coping, prioritizing relationships, coping in ways that strengthen family bonds. It means being mindful of the impact of our own stress and individual coping strategies on family relationships. It means counting on other family members for support to cope with the stress. It means appreciating the support given to us, being able to identify when other members are stressed, provide support to others to cope, shifting from your or their problem to our problem, and engaging in conjoint efforts with others in the family to cope with the stressors. So this is simply a graph that shows that figure that when there are stressors coming from outside, they may affect one individual member, but they may affect more than one individual member. That's the case particularly with economic stressors, where you have both parents stressed over the same situation. But even if they are not, sometimes we have contagion, crossover of a stress. And if not, through the process of a spillover, we have that all family members end up being stressed. In other ways, when there's one family member that's stressed, most likely the rest of the family system is stressed, of the family members are stressed as well. So now going more in detail into relational coping, the stress process, when in the program we have actually to help couples with financial stress, we teach them first to understand the signs of stress in themselves and the impact they can have on others. We also ask them to observe and learn about the stress in others to be able to assist them. And we also suggest that it's always good to let others know when we experience a stress and we're concerned and preoccupied about the stressor. And we also indicate to them that the possibilities are that other family members give no response to our stress, which of course you can imagine is negative, or that they respond negatively, which this involves those situations in which the response is not supportive. It can be hostile, blaming, or perhaps not sincere. But then we have the positive ones, and those are the ones I'm going to focus on because those are the ones related to positive outcomes. When we experience stress, others in our family can respond by giving us emotion-focused support. Remember, making us feel different. They validate us. They help us look at things differently. They can be helping us resolve the problem through solution-focused, but they can also take over some of the things we do to release our stress. That's delegated coping. And then the most important one for me is this one, common or sometimes being called communal coping. And the communal coping, when more than one family member experiencing stress, which is usually the case, we come together to look at the stressor as a sort of we problem. It's something that affects all of us, and therefore we're all involved in trying to cope with it. So we engage in conjoined coping. That doesn't necessarily mean doing the same thing. It can be taking complementary roles, but it means all coming together to cope with the stress. During the pandemic, the study showed that couples that have coped better and had actually come out strengthened out of the pandemic are couples in which they were looking at the pandemic, as we should all have looked at the pandemic as affecting all of us, but they reduced the blaming each other. The problems were always outside the family. And so, of course, it's common wisdom to realize that when you come together and the enemy is outside, that unite us instead of like trying to fight each other. That sounds like very simple to say and very difficult to do when you're involved in close relationships. So teaching family members to do that is very important. And so is engaging in stress-reducing activities together. So one of the things we do in our programs is like from mindfulness, praying, exercising, anything that helps strengthen our spirit are not done individually but conjointly. We also share those moments. The benefits that relational coping have are not just for the relationship but also individually. The research shows that we have greater health and psychological well-being when we cope relationally. And actually, when we measure together individual coping and relational coping, we know that relational coping has more benefits than individual coping, or above and beyond the effects of individual coping when it comes to relationships. Positive effects include that people communicate better with one another. They are better at conflict management. They experience lower levels of aggression, better problem-solving skills, a sense of higher shared meaning, increase in intimacy, and most importantly, relationship stability. Definitely, relational coping acts as attenuating the effects of stress on relationships. And it's important to note that when we compare giving support to another person, to another family member, supportive, versus working conjointly in the resolution of the stressor or in making us feel, in working together to feel better, that common dyadic coping has a stronger effects in terms of benefits for the individual and for the relationship than just giving support to one another. They're important. This is true across studies in different parts of the world, even though there are some cross-cultural differences, such as, for example, in the way that we express stress to each other, or like we ask for help. And there are important gender differences as well. As has been said here, women tend to engage more in relational coping than men do. And that's why it's important to bring together two programs, not only women, but actually the whole family, and particularly men. Okay, give me 1 second. So we're also encouraging these programs to cope relationally, to have families that spend more time together. There's a lot of research cited in my paper about the value of family times, even rituals such as, lunch together, protect the mental health of children and even adults. So really trying to find time to be together with the family because that increases understanding and validation, emotional connection, cohesion, reduce feelings of loneliness, share meaning, and it's important for learning and growth. So can I take 2 more minutes? Okay. Recommendations that I can give based on the research that I've done and that I know is that, of course, there's a big role to be played by the institutions and organizations in terms of promoting and facilitating the time that families can be together. But then there are also programs and different levels in which, important messages can be transmitted to families, and it can start with schools, and it can be actually in on programs offers to the community. I would say that during times of crisis, it's important to emphasize the value of healthy family relationships, the importance of nurturing family bonds, and their vital protective role during crisis. Encourage and help families spend time together, especially meaningful time together, and help families strengthen their communication, conflict resolution, and emotion regulation skills. If I had a magic wand, I would like that to be taught in the school system, to have kids and families work together on this from the very beginning outside, moments of stress. I think that it's critical to develop positive, healthy relationships. That's the most important vaccine we can have against all the problems, many of the problems we see in society. And of course, educate families about the negative effects of chronic stress on relationships and individual physical and mental health, and the value of using relational coping to strengthen family bonds, and encourage families to engage together in stress-reducing activities. I want to say that the research shows that when you educate individuals about the negative effects of stress, they actually take a proactive approach and do something about it. And that's what makes a difference between being absolutely negatively affected by stress or actually being resilient. So at the end of my paper, you have the description of this program that we have been doing with families. We have served over 1,000 families, thanks to generous funding from the Administration of Children and Families in the United States. We serve low-income African-American and Latin American immigrants, and the goals are to decrease stress, improve relationship functioning and financial capability, because we work with couples that suffer from economic stress and for relationship distress. We teach them lots of skills, and we provide for that a workshop, and where we work together with both members of the couples. And we also, it's very important, we also work with a case manager that assesses the needs of all family members and connect them to resources in the community. We tested this through a randomized control trial. It's the most serious type of test you can have for effectiveness of an intervention. And the program really showed that couples working together could lower their stress levels, have better functioning in their relationship, higher satisfaction, but also we could help them increase their use of budgeting, and they perceived that they were managing their finances better. And so that's an example of an intervention or psychoeducational program that you can do to actually help families in times of crisis. So, sorry.